Dr. Oz, I don't believe in accidents. And I think maybe it was, we were all very fortunate that you're not sitting on this side of the dais, but you're sitting on that side of the dais, because I think what you will be able to do in your new capacity will outstrip anything you might be able to do as a legislator. And I'm excited about your nomination and the opportunities that will provide. The General Government Accountability Office, well, let me premise this. You said that there were people, and I'm interested in knowing their names, 150 people who don't want anything to change in terms of our healthcare system. I'll ask you a written question so you can provide us those names. I'd like to know who they are. But I will tell you there are people in Congress that don't want anything to change when it comes to our healthcare delivery system. That includes presumably $521 billion in fraudulent payments included for our entitlement programs, including Medicare and Medicaid, $2.7 trillion in improper payments over the last 2 decades. I presume when they criticize some of the suggestions for reform, that means they don't want that to change either, and it must change. We're at $36 trillion in debt. We're paying more money on interest on the national debt than we are on defense. That's unsustainable and in a very, very dangerous world. I know you will agree. So let me talk to you about something that I think you're uniquely qualified to address, and that is preventative care and keeping people healthy. Part of the problem is, you know, we talk a good game when it comes to health care, but then Congress has policies, particularly in our farm bill, with the food stamps, the SNAP programs, where we subsidize people eating and drinking exactly the wrong kinds of foods in order for them to stay healthy. And then we come up with a shot, which will presumably help you lose weight, and we say, well, maybe we ought to subsidize that too. It just strikes me as crazy. So what can we do to incentivize the healthcare community? Because right now we don't do it. We pay doctors and hospitals to treat people when they're sick, if it's coded by HHS or CMS. What can we do to incentivize the healthcare community to help people stay healthy longer and avoid chronic disease and the pain and misery and expense that go along with that?
Senator Cornyn, I appreciate all the help you've given me throughout my career and your kind words. When I called a good friend after the nomination who'd been involved in the campaign, he said, it's just like we planned it out. It is remarkable that although we all agree that value-based plans and programs should be the foundational way that we incentivize doctors, nurses, and others, hospital systems to deliver care, we make it difficult to use those plans. We use third parties as intermediaries who often charge so much that they take away the benefit of the value-based program to begin with. But at its very core, physicians need support. Everyone providing care needs support to be able to do what you just said. Giving patients advice on lifestyle takes a lot longer than telling them to take a pill. Doing surgery on people pays so much more than giving them advice about how to avoid operations that it's difficult to imagine anyone not doing the wrong thing in that model. I remember early in my career, I was asked to help develop the advertising plan for New York Presbyterian Hospital I was practicing, and they wanted to talk about new technologies and this and that. I said, that's not the question patients ask. Patients want to know, when you offer them heart operations, do I really need it or not? That's the first question. And we don't reimburse that question's answer, which is what we should be doing. I believe, and we've been asking questions back and forth about AI, that we can use technology, information technology, artificial intelligence in particular, to provide more of that infrastructure support so that when the physician talks to you, the main thing they say is, I endorse what you just heard about a lifestyle change for you in particular based on your background, any history we have on you, and all of the other places that the healthcare system has touched you. For much of this to happen, we have to know who you are. So one idea that I think will come up eventually is this concept of how we can tell which patients have been in which centers. All that interoperability of information and transparency safely shared with you, the patient, I think will arm you with a bit more motivation to take charge. And for people who are recalcitrant, as Senator Wyden has been talking about for more than a decade, I do think reward systems could be beneficial.
Well, there's so much more I want to talk to you about, and we'll do that after you get confirmed. But let me just say that if modern medical science can devise a shot or a pill which will give me the self-discipline to exercise on a regular basis and to eat a healthy diet, I want to be first in line for that shot. Unfortunately, I don't think that shot or that pill exists. So we need you to use the bully pulpit because you're a great communicator. I believe you can be a tremendous asset to communicating to the American people the importance of doing some of the things that will make their life happier and healthier. Thank you.
God bless you, sir.